Chief Berryhill. Thank you.
Thank you, Mayor Elfin. Good evening, Mayor and Council. I'm Kyle Berryhill. I'm the Interim Fire Chief, and I'm presenting on the latest of the COVID-19 public health crisis. We're 1 week further into this wave of the COVID-19 public health crisis in the new Delta variant. And as has been reported in the local and national media, Florida and subsequently Flagler County are experiencing a surge in the coronavirus. 3 weeks ago, Flagler County had 88 new cases. 2 weeks ago, 400. And as of today, Flagler has 671 cases in the last 7 days. We believe the Delta variant is now the predominant variant. The data shows it to be 50 or 60% more contagious strain of the virus. It's essentially as contagious as the chickenpox. The CDC recommendations for areas of high transmissions, which includes Flagler County, is to encourage mask use when indoors, in crowds, to practice social distancing when possible for both vaccinated and unvaccinated individuals. The data still shows that the vaccines are effective against the Delta variant, providing significant protection from both symptomatic disease and hospitalization. There are absolutely breakthrough cases where vaccinated individuals have contracted the disease. However, these individuals perform much better against the coronavirus. Vaccines reduce transmission, reduce symptomatic disease, significantly reduce hospitalizations, and perform in the 99% range of preventing death from COVID. This week, we began to experience workplace impacts due to the spread of the coronavirus. Multiple departments are dealing with COVID-positive employees and working through the challenges associated with that. Anecdotally, a rough estimate of last week's fire department calls for service found about 1/3 of the calls were either confirmed positives or suspected positives. Our call volume is up. Last year, the department ran just over 11,000 responses. This year, we were on pace for 12,000 through June. If we kept up the July pace of 1,200 calls for that month, our annual rate of calls would be 14,500, and July is typically our slowest month when it's raining like it is today. Asymptomatic people not in the medical field or working in congregate facilities do not need to be tested. Our citizens can find a list of symptoms on the CDC website, and a list of testing options can be found at www.flaglercounty.gov/COVID. Vaccines continue to be available at the local pharmacies, and vaccination locations can also be found at the Flagler County/COVID website. Finally, we've witnessed many citizens begin to change their practices over the last few weeks. And they show us special appreciation when we see them in the community, and we really appreciate that. We encourage our citizens to review the CDC recommendations, to make the choices that is best for their families, and to continue to show respect and consideration for each other, our neighbors.
Was a presentation. I just, if I may, Ivan, I just
Yes,
want to
sir.
thank you. I just want to thank you for your care, the one you've shown throughout this whole thing. I just, when it comes to the vaccines, plenty of my friends, and I consider almost everybody out there my friend, we have to think of one thing. We have plenty of people out there, especially countries like Afghanistan, Iraq, they are willing to take a bullet for our country. Some of us over here wouldn't take a needle for our sons and daughters and neighbors. Please think of that. Be a hero, in my opinion. Thank you.
Do any of our council members have a question or a comment on the presentation?
No, I would just like to reemphasize the urgency, not from a vaccine perspective. Perhaps a more effective avenue is the fact that our hospital is now in status black, where certain procedures and elective procedures are being canceled, and it's impacting people who need hospitalization from all sorts of other things besides COVID. So this is extending beyond the bounds of whether or not it's a personal decision on vaccination, and I strongly encourage vaccination, but be aware that this is starting to impact people beyond COVID. There's two buttons in life you should never push: panic and snooze. And we're at the point now where we're leaning our hands on both of these, and we need to make a decision and be personally responsible to try to protect individuals from COVID, but also from anything that can happen to you where all of a sudden we don't have a hospital where you can be served. So please be careful.
Thank you. And I'm going to add to that. We've been in discussions at the city throughout the day, in preparation for these comments tonight, but more importantly for the plan going forward. And I'm reminded of a quote that goes way back in time from a president that you all will remember. And the quote goes something along the lines of, ask not so much, and I'm not quoting it, I'll make up my own words here, not so much about what your city and your state and your county can do for you. I'm going to plead to all of our residents, it's now time for each of you, for me, for our council members, for our staff, and for our residents to make a bold move forward, to make a choice. The health department recommends 3 different things that you can do. You will have to make a choice and pick 1, 2, or all 3. You can get a vaccination. We have vaccinations. You can mask. We have masks. You can social distance and clean up. You have the choice. So I'm putting it out to myself and to the residents and the citizens of Palm Coast. Make that choice. Start thinking about what you can do and start thinking about how you can better protect your neighbor across the street, next door, your family, your friends. I want each of us to begin to take that responsibility. So, Chief, thank you very much.
Thank you, Mayor and Council.
Thank you.